Check, 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 check.
Kind of on the west coast side of the states right now.
Yeah, I'm just outside of Colorado Springs right now. We're in our spring break, so we love the mountains out here in Colorado. So that's where we're at right now.
So, like yourself, I'm going to make my video go away, and you can take it away.
All right, so you should see Taming the Dragon opening PowerPoint there. Is everybody able to see that one?
Yes.
Awesome. So we are recording this today, and the other thing is at the end of this presentation, there will be a QR code as well as I will send the link at the PowerPoint for both the recording and the PowerPoints to your instructor. Feel free to take this and use it. When I do a presentation, one of the things I always like to tell people is that if you decide you want to give this presentation sometime in the future, take my name off of it, slap your name on it, and I give you full permission to use everything that's on there. So, as Mr. Hearn said, my name is Bill Young. I do have a doctorate, and I'm proud of it, but I grew up in Eastern Kentucky, worked in Tennessee for a bunch of years, and so I'm just Bill. And so the other thing I would tell you is, as we're going through this, and as we get towards the end of it, if you have questions as I'm going through, please don't hesitate to throw that question out there and let me know. I love questions. You are not going to offend me by interrupting and stopping it again. As far as anything that I can do to help you, that's what I'm all about. So, as Mr. Hearn said just a second ago, let me give you a little bit of my background. And this is not from arrogance or to puff me up, but you have a right to know whether somebody who's trying to tell you how to be successful in a registry exam, if they know what they're talking about. One of the things that you'll find out on the internet is that there are tons and tons and tons and tons of people who say, "Oh, I can help you to pass the registry exam," when in reality they're just looking for you to take your money. And so in this situation, all I'm wanting from you today is just a little bit of your time. I've been in EMS since 1975. Yes, I realize that most of your parents were not born at that time, so that means I am an old guy and I've seen a lot of things. I've been on the board of directors for the National Register. I'm the current National Association of EMS Educators president. But one of the things that I'm most proud of is that those questions that you will see either as an EMT or as a paramedic, I helped build them. And so a few years ago, the registry contracted with about four EMS educators, and we went on a tour and we gave a day long webinar, or not webinar, a day long pre conference on how to best pass the registry exam. And what I've done here is kind of gone off on a freelance of doing the same thing. And this is pretty much in my opening slide. Now, one of the things I want to stress to you is it doesn't matter. Now, you're going to see a lot of paramedic level questions in here because most of the time I'm giving this to paramedic programs. But what I'm going to do is I'm not going to test your knowledge. I'm not going to ask you about things at the paramedic or the EMT level. But what I'm going to do is I'm going to give you some strategies on how to pass the registry exam. So everything I'm going to share with you, regardless of what your level is, from EMR all the way up to paramedic, will be very, very pertinent. Now, as you're very well aware, a little over a year ago, registry changed out their type of questioning, and here's the reason why. Registry, much like your paramedic program, is accredited. Registry also has to have an accreditation, and their accrediting agency says, you can no longer, if you want to be accredited, you can no longer give a psychomotor exam as part of the certifying process because there's no way of verifying that an exam given in Tennessee is of the same quality as one that would be given in Kentucky or Kansas or Colorado or anywhere else. So what they did was that this is not new to healthcare science. These are the same types of questions that nurses, physical therapists, physicians, and respiratory therapists. They've been using these questions for years. So what happened on July 1st, 2024 is that they went to these new technology enhanced items or TEIs. What I'm going to do is I'm going to go through and I'm going to show you a little more information about that. I'm going to give you my email information so that if you want more information on how to best approach the registry, I'm more than willing to help you in any way that I can. One of the key things that I'm going to tell you here that's going to be critically important is do not worry about running out of time on the exam. Less than 1% of the people, and this comes from Bill Seifert, who is the executive director of the registry, less than 1% of the people who take the registry exam runs out of time. You and I both know that it's a timed exam. And so, you don't have all day to take it. But part of the problem is because people are so afraid that they're going to run out of time, is that they'll rush through this exam and they won't read the words. Now, the other thing on that is, so first of all, let me back up here. So first of all, slow down. You've got about a minute to a minute and a half per question. And so that's a long time. That gives you plenty of time to go through to read it, read all of the distractors being your question answer options, and make sure that you know what the question is asking, as well as making sure that you know what the question is not asking. So that's number one. Number two is I'm going to tell you that you got to read every single word. There is no fluff in a registry test question. Now the questions have gotten longer and more words now because many of them are going to be scenario based. But again, there won't be anything on there that does not pertain to you getting the right answer. There won't be any. It was a dark and stormy night. We had posted it at the quick stop after our 13th call, and my partner was in getting roller food because we hadn't eaten all day. No, that's all fluff. So every word that is in that question is vitally important. Registry's not going to put any extra words in there. Here's the other thing it's critical for you to understand. Know where you are in the scenario. If you're given a question, and you'll see some of these questions here in just a minute, if you're given a question that says you've got a 68-year-old male who's complaining of chest pain, your 12 lead shows that he's having an inferior wall STEMI, you should do what? And one of the answers in there may be assess his airway. Now, there's an old urban legend out there that says if airway is one of the questions, always pick airway. That's a really good way to miss a bunch of questions. Here's why. Because it tells you got a 68-year-old male who's had complaint of chest pain and you have already done your 12 lead. Where does that put you in the scenario? That puts you way beyond your initial assessment of where you have already assessed the airway. So again, make sure you know where you're at in the scenario as you're answering that. If you're all the way down into the assessment and you're let's say you're assessing a fractured leg, you're well beyond the scene safe BSI answer. Okay. The other thing I would tell you as you're looking at is that, and this is particularly important for those of you who are paramedic students who have a background in EMS. This is one of the great challenges for people who are experienced EMS responders, and this is one of the limitations of this type of exam. And it's a limitation just because all exams have limitations. Don't play the well, what if game. Okay, what do I mean by that? Well, here's the thing. If you're looking at this scenario and you've got answer A, B, C, and D, if it's just like a multiple choice question, if you're an experienced EMS responder and you're looking at this, you would say, well, if this were to be in situation, I'd pick A. And if this were to be in situation, I'd pick B. You only want to look at the information and take the information verbatim. Don't add to or delete from in the question so that you can know which answer is to pick. And so this is one of the challenges that many experienced responders, you're thinking like a clinician, which is exactly what I want you to do if you show up at my house for my emergency or my family's emergency. But when you're taking your registry exam, you want to make sure that you are just thinking on a linear basis of this is what the question says. Don't add to it. Don't take anything away from it, and use that to to get your answer. For my firefighter brothers and sisters here, there's the other thing is if you've got a question that deals with hazmat, if you got a question that deals with urban search and rescue, you got to turn that part of your brain off as well. When you are taking a registry exam, you come in and what they're doing is they're testing you on entry level knowledge as an EMS responder. You may have all types of experience, and I have a lot of students who do. They come in, they have certifications as FEMA responders. They come in, they have hazmat certifications and ethyl methyl bad stuff, and they know all these things. And this is what they would do under a normal circumstance. But what you want to do is you want to turn that off and you want to think solely as an EMS responder, an entry level EMS responder. So that means on these questions, you're not going into buildings that have collapsed. That means on these questions, you're not going into a hazmat scene of where maybe you've got an agricultural situation and an ammonia tank is leaking. And under normal circumstances, you would go in as part of the fire department hazmat team, but don't do that. Okay. So kind of keep that in mind as far as when you're going through. Now, here is your basically what you're looking at, okay? The exam is not tougher now than what it was before. Both the exam before and the current exam is solely there to build and to assess entry level competency. Doesn't mean that you're coming out and registry is going to test you at a 1 year or a 2 year experienced paramedic. It's basically going to say this person is minimally competent so that when they go out, they're going to do good things and they're not going to hurt patients. This is your time frame for your paramedics. You got 3.5 hours, and you'll see a minimum of 110 questions. For EMTs, you will have, I believe it's 2 hours, and you'll see a minimum of 75 questions. Now, let me give you a little bit of heads up here. The number of questions that you get means absolutely positively nothing as to whether you passed or not. Okay. If you get a few amount of questions, what that says is that the computer algorithm was able to assess and determine that you were competent or not in the minimum amount of questions. If you get the maximum amount of questions, it just simply says that the computer algorithm was able to assess you. It took it longer to assess you. So again, question numbers mean nothing whatsoever. As far as the logistics of when you would take this, keep in mind that back in the dark ages when I went through paramedic school, we had to wait anywhere from 6 to 8 weeks for an envelope to arrive. And when you went out to the mailbox, you knew instantly whether you had passed or not, because if you had passed, you got a big envelope with a certificate in it and a patch. And if you didn't pass, you got a little tiny envelope that says, sorry, play again. With the system that they have now, if you take your exam in the morning on a Monday through Friday, you'll usually get your results by 5 o'clock that same day. Other people are getting them really, really quickly. So they've sped that process up. If you take them in the afternoon, usually it will be after 9 a.m. Eastern time when you will get your results. If you take them on a Friday afternoon or a Saturday, unfortunately, you're going to have a really long weekend, and you probably won't get those until Monday. So that's the kind of thing to keep in mind. Typically, what registry will tell you is that they'll have results to you within 3 days. If you don't get them within 3 days, contact the registry, and they'll take a look at that and help you know. So What's being evaluated here is what's called clinical judgment. This is as close as the current science can come to help you to determine whether you're safe to go out and to begin practice or you need more remediation. Now, again, when we're looking at this, what's happening is that you're being evaluated with these questions on all three phases of the call. As you can see down in here, we have en route. So these are going to be some en route questions of maybe you thinking about, and I'll have some examples, maybe you thinking about traffic patterns, weather, school getting out or school coming into play, trying to come up with the safest route and the safest way. The other thing that you would do in this situation, and again, this is true regardless of whether you're paramedic or EMT, is that you would be thinking through, okay, what are my differential diagnoses based off the information that dispatch is giving me? And that's going to be really, really important for you to be able to go in and take a look at. So these are the questions, types of questions that you will see, and I'll have some examples for you here in just a minute. Then you're going to get on the scene. This is where the meat of your evaluation is going to happen. You can be asked questions about the scene assessment as to whether it's safe or not, your patient's initial assessment, your secondary assessment, as well as your treatment. And remember, ladies and gentlemen, anytime you give a treatment, I don't care if it's putting a splint on or if it's giving oxygen or doing RSI or defibrillation. Always, 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 especially as part of your testing process, want to go back and reassess the patient to find out, did it work? Did it not work? And is my patient getting better or is my patient getting worse? The last part of this is going to be your post scene. This is going to be questions about from the time you leave the or the scene and going to the hospital to the time you go back into service. Questions that you may see on this type of situation is going to be things about are you taking the patient to the closest appropriate hospital? What are you going to do on the way into the hospital as far as the treatment of our patient? And then other things that you would see as far as the post scene would be questions about your documentation, how you would document it, who you can share that information with. And so each one of these three areas are going to be evaluated throughout your overall exam for when you're going to take it. Now, multiple choice, we're all pretty much familiar with. If you're using FISDAP gives some pretty good multiple choice questions. And within multiple choice, we know that you have to pick one answer, okay? Now, in this situation, many times students will say, but there was more than one right answer. And I'll talk to my students and I'll say, well, what do you mean by that? And they'll go back and they'll play the, well, what if game. And they'll say, well, if the patient did this, then A would be right. But this is where you have to go back and you only look at the information that you're given in the question itself. Don't add to or take away from. And there is one best answer in that. Now, again, many people kind of get a little bit of heartburn at that best answer or the most correct answer and say, well, that's really subjective to the person that's writing it. No, not really, because again, in that question distractor or in that question stem, the question itself, you're being given all the information of what your patient is doing and where you're at in the scenario. Remember, we talked about that just a minute ago. So as long as you know where you're at in the scenario, you're going to go into there and you're going to pick out the best answer. So, for example, here's a multiple choice item. For which of the following situation is midazolam indicated? Now, one of the things I will tell you on your registry exam is if you are weak in medical terminology, you got to bulk that up. Registry will most of the time use the generic names of medications because, again, generic medicines are typically across the board within healthcare. The other thing I would tell you is that it's important to be strong in medical terminology because the example I like to give is if your patient's having a gallbladder attack, registry is never going to ask you a question about a gallbladder attack. They will ask you about cholecystitis, which is the medical term for a gallbladder attack. Again, if you need resources on that, I've got some free resources I am more than happy to share with you. But in this question, it says, for which of the following situations is midazolam indicated? So the first thing you got to look at in the question is, well, do I know what midazolam is? Because I got four situations here of pain relief, seizures, nausea, or dysrhythmias. So midazolam is a benzodiazepine. We don't normally give that for pain, although we can, okay? But the main reason that we would give midazolam would be for seizures. Now, again, we know that if a patient's having back spasms, yeah, it's possible that we may give midazolam because it's going to relax the back spasm and reduce the pain. But we typically don't give midazolam or a benzo for any particular type of pain relief. So that's kind of how you would handle the multiple choice item. And again, as we're going through here, Ben, if you got students that want to ask questions, just have them shout it out to you and share it with me, and I'm happy to stop.
Okay.
Now, in this situation, many times, remember we talked about a minute ago, we said, well, there's more than one right answer. Well, guess what? You're exactly right. There will be more than one right answer on multiple response. And in this situation, again, you got a scenario. Make sure you read the scenario, and you will have five responses, five potential answers, or you may have six potential answers. Now, in this situation, if you've got five potential options, they're going to want you to pick the two that are the most correct. If you've got six, they're going to want you to pick the three that are the most correct. Now, here's one of the really, really good things that Registry has done for you. Registry fully understands that when you go in and you take your registry exam, you're going to be stressed. And I'm going to give you some strategies towards the end of our session here to help you to manage that stress. But they know that you're going to be stressed. So if you were to go into this question and you're looking at this and you've got a pick the two out of the five or the three out of the six, and you get in there and you're looking at those five options and you forget where you're at and you only pick one and you hit submit the question, it will not allow you to submit the question. A pop-up will come up and it'll say you must pick a minimum of two, and it won't let you pick more than two if it's solely asking for two. So that's one of the good things that they've done to help you kind of stay on track. So again, those are the things that we're looking for in that particular situation. And here's an example. Which of the following interventions have consistently been proven to save lives in patients with sudden cardiac arrest? Select the two answer options that are correct. Or is it intubation, epinephrine, defibrillation, early vascular access, or immediate chest compressions? Now, in this particular question, it's wanting you to know a little bit about research. So I know that within your course, because I know Mr. Hearn very well, I know you're getting a quality education there. I know you guys have talked about the things that are really, really top notch that would show that these two things can answer, because all of these things are going to be things that we're going to do in a cardiac arrest. But there's only two that have been shown to help patients survive cardiac arrest, and that's defibrillation, especially early defibrillation, and immediate chest compressions. And that's kind of the process that you're looking at here. And again, if you were to go in here and only select defibrillation and go in to submit the question, won't allow you to go forward. So that's your multiple response type of questions. The other type is called a build list. You're going to get a scenario, and all of your questions are going to be scenario based, or I would say 98% of them are. Registry doesn't care whether you know what a normal blood pressure is. Registry has no desire to know if you know how many bones are in the body. What they do want to know is if a blood pressure drops or spikes really high, how do you manage that as an EMT or a paramedic? If you have a fracture, what are the things that can happen from the fracture? And part of this is the build list. In this situation, you'll get your scenario and you'll have to position several options in most of the time it will be from the most indicated to the least indicated. And this is kind of what you would see here. A woman presents with unilateral weakness, facial droop, slurred speech. She's conscious but confused. What should the paramedics suspect as being the most likely problem? And so what we've got here is we've got four options over here that could all be related to one or more of these particular scenarios or these symptoms in this scenario. But what you got to do is you got to, again, go back, look at your scenario. She's got unilateral weakness, weakness on one side. She's got facial droop. She's got slurred speech. She's conscious and confused. So in this situation, again, from seizure, hypoglycemia, ketoacidosis, or ischemic stroke, this is building your differential diagnosis as far as from the top down to the bottom. So if we're looking at the most likely cause based on the information we got in here, it's going to be a stroke. The second thing is most likely going to be hypoglycemia. The third is going to be a seizure, probably within that postictal phase. And the least likely is going to be in here is going to be ketoacidosis, because ketoacidosis really does not come into play with unilateral weakness or facial droop. Can see it with slurred speech, and we can see it with a patient that is confused. So that's kind of the process of how you would use and do a build list. With drag and drop. Now, basically, again, this is going to be similar to what you just saw with a build list. The candidate must position several presented options into certain categories, classifications, or other identifiers as specified in the item instructions. And many times, what it will be is you'll have a scenario and you'll have treatment options, and you will drag them over into, if it's a treatment option, of indicated or not indicated. So as we look at this, here's our scenario. 58-year-old man is in cardiac arrest, CPR is in progress, and a slow, narrow, complex PEA is showing on the cardiac monitor. What treatments are indicated? What treatments are not indicated? Move each option into the answer area 3 times to correctly show the 3 treatments that are indicated and the 3 that are not indicated. So in essence, what you're going to do is you're going to come right over here and you're going to pick up indicated and you're going to drag it over into whether atropine would be indicated or epi or TCP. And you're going to do the same thing for 3 options for not indicated. Now, again, much like we had with the multiple response that we had a while ago, if you pull that over indicated and you pull it into less than 3 or more than 3, the question will block you and will not allow you to go on. It will say only use this 3 times for each option. And again, that's because registry knows you're going to be stressed and you want to, and they will not allow that stress or trying to minimize that stress to work against you. So in this particular situation, we would see atropine is not indicated. It's PEA. And this is a really, really good, challenging question because, again, we're looking at, do you know what your treatment protocol is for a patient that's in PEA? So atropine, we're not going to give. Epi, yeah, we're going to give epi until we run out or we get ROSC. TCP is not indicated because there's nothing there to pace. We are going to put in an airway and we are going to ventilate. And in this particular situation, sodium bicarbonate is not indicated in this particular patient. So 3 indicated, 3 not indicated as far as when you're going in there. You can have an options box. Now, again, let me stress to you, you will see multiple of these different types of technology enhanced items or TEIs. You're probably not going to see all of them. Okay, so don't freak out if you don't see all of these options, but I would dare say that, again, the majority of your questions will be multiple choice questions, and probably about 10 to maybe 20% of the questions that you get will be these different types of TEI. So in this one, you have an options box. In this particular situation, you got to classify, organize, or identify your options and put them in a table based on the specified criteria. And remember where we're going to find that specified criteria? It's going to be in the test question itself. Again, that's why it's so very important that you read the question. This one is a question that we would look at here, and it's a pharmacology question. It's not so much of a scenario based question as much as it is knowing straight out, do you understand about pharmacology, and do you understand the physiology of what's happening within the body? So the question is, what are the actions of antidiuretic hormone, ADH, and renin, and what are their sources? And what you're going to do is you're going to select the correct answers in the table below. So you've got two actions with angiotensin 1 production, and you got decreased urine production. And you got to decide, is that ADH, antidiuretic hormone, or is it going to be renin? Going to be similar. It's going to be pretty much as far as down to the second question or second part of the question of the source. Okay. Is the ADH coming from the kidneys or the hypothalamus, or is renin coming from the kidneys or the hypothalamus? Again, there's a safeguard in here so that you cannot move on until you've made two selections for actions and two selections for source. And in this particular situation with angiotensin 1, it acts like renin. With ADH, we know that it decreases urine production. With where it's coming from, ADH comes from the hypothalamus, and renin is coming from the renal system. And this is one of the reasons, just kind of a bonus thing here. This is why you want to get a good history on your patients, because you've got history. If you got patients that have renal failure, they can go into shock really, really quickly because their compensatory mechanisms do not function nearly as well. This is a question I really, really like. These are graphical items, and you will see pictures with a scenario. Most of the time, the picture will be an EKG, either a rhythm strip, or it could be an entirely full 12 lead. Sometimes it will give you what am I trying to say? Oh, capnography. It'll give you a capnography screenshot on your monitor. Other times they'll use pictures. They'll go out and they will stage these different types of scenes. And in particular, if they're asking you to assess your ability for how well that you would know the ability to assess for scene safety, and they'll ask you to look at this scene and to identify what would be the most dangerous thing for you. In this particular situation, this is a prime example of what you would see. You had a 56-year-old male who presents with the following cardiac rhythm. He's conscious but confused, and he's got a BP of 60 over 40. What should you do? Now, it's not asking you to identify the rhythm, but in order to get the right answer, you have to be able to identify the rhythm. So what we're seeing in here is that we're seeing a patient that has a slow bradycardic rhythm. He has a low blood pressure, and he's got an altered mental status. So what we're going to do, we got to increase his pacing. Now, again, there's two questions that are, or two answers in here that are, you can look at this and you can say, well, with a bradycardia, I would go in there and I would give a milligram of atropine first. But what you're looking at here is you're looking at a high degree heart block. And we know that we don't give initially atropine to high degree heart blocks, but because we don't want to delay pacing. That's going to be the gold standard for your treatment for this particular patient. And so we can start an IV line and give norepi, but again, that's going to take a while. That's why putting the pads on your patient and starting the pacing on your patients are going to be the best. Now, this is the grandmother of all types of questions. These are scenario based. In these scenario based items, you're going to see the three phases of a call. You're going to get a dispatch phase, you're going to get a scene phase, and you're going to get a post scene phase. Now, here's the thing you got to remember. Of all the questions that I've shown you before, any or all of them could be part of these scenario based items. Now, again, I want to stress to you, when we're talking about scenario based items, we're talking about the TEI items. even if you get a multiple choice question, it is like 90 to 95% probability that in that multiple choice question, it's going to be scenario based. And so you got to be able to read that scenario. So here's kind of an example of what you got. The paramedic is dispatched to an auto body repair shop for a 29-year-old man trapped under a vehicle. Time of the call is 15, 20 hours. Response time is 8 minutes. Paramedics got an EMT partner, and a BLS fire department engine is dispatched with the ambulance. The weather's clear and the temperature is 84 degrees. You got a level 3 hospital located 9 miles from the scene and a level 1 located 22 miles from the scene. Let me stop there. And I know I'm repeating myself, and trust me, it's not because I'm old and forgetful. Every word in that scenario is important. Don't speed over it. So on this particular one, you're going to have just basically a run-of-the-mill multiple choice question. Which of the following factors is the most important for the EMS crew to consider during response to the scene? A, schools may be getting out of session. B, they should avoid as many stoplights as possible. C, they should immediately request air medical support. Or D, they must obtain the patient's past medical history. Well, the school's getting out at 15:20, at 3:20, and so you got to be worried about kids in crosswalks, on sidewalks, and understand that kids, when they see ambulances, fire trucks, police cars, they're going to get excited. Who am I kidding? I'm 69 years old. When I see those things, I still get excited. Uh, and so one of the things you got to remember is if you're going through a school zone or on the way home for places where students will still walk home, that's going to be a safety issue that you got to take into consideration. So that's going to be the most important thing that you're going to look at. Now we move into the scene. Now you can have multiple questions within each one of these phases. So you can have multiple questions in the route, the scene, and the post scene. But now we're here on the scene. You got a 38-year-old male, a 38-year-old construction worker who is impaled in the upper thigh by rebar. You've already applied a proximal tourniquet and bleeding is slow but not completely stopped. Patient's pale, diaphoretic, and has a weak carotid pulse. His blood pressure is 92/58, heart rate is 134, and he's no longer responsive to verbal stimuli but withdraws from pain. His airway is intact. SpO2 is 95% on high flow oxygen. The scene is secure and extrication is complete. Now, again, a lot of information in there. Nothing is extra. So you come over your question and says, what action should the paramedic perform while still indicated and which ones are of lower priority? This is where you're going to drag and drop. You're going to drag the first priority, 2 second priorities, and 2 that would be not indicated in this particular situation. Now, in this particular question, what they're wanting you to do is, first of all, can you prioritize treatment based upon what you see in here? In this particular situation, our patient is most definitely in decompensated shock, and he is not very far from going into irreversible shock. So that would be our first priority. And then everything else after that would be secondary priority. But there's some things over here that we're not even going to bother to do. So as we're looking over in here, your first priority is we're going to assess for other bleeding. We already know that we've got information that's on there. And so the other first priority is inspect the oral pharynx. We want to find out exactly what is going on with this. Now, here's a thing to remember. Now, we know that from the beginning of registry, when they went to computer-based testing, you couldn't go back to a previous question. And that's still true. Kind of. You can't go back to a previous question that you're looked at, but when you're in this 3-part scenario, what you can do is you can go back to a previous part of the scenario. So again, if you need information from the dispatch or the en route phase to answer the scene phase, you're okay to do that. Now, once you submit your questions, they're gone forever. Okay, but you can go back from scene back to en route, and you can actually do the exact same thing with the post scene. I'm going to skip through here because there's a bunch of different questions. You're free to take a look at those when I send them out to you. So I got a bunch of freebies in here for you. We move into the post scene. Transport is initiated to the appropriate hospital. The patient is closely monitored and treatment is continued, and the hospital is notified of your impending arrival. So, what they're wanting to do here is when notifying the hospital what's the most appropriate order in which you should deliver your radio report. So, this is challenging you on do you know how to go to give that brief radio report to go from the most important to the least important, and you're going to drag and drop your things in there. Again, even though we're in the post scene, if you need to go back to the scene, if you need to go back to the en route section and read just the information, that's 100% okay. You won't see the questions that you have already submitted. And here's some more. Here's another one of saying, how do the clinical signs of pneumothorax differ from those of traumatic brain injury? So this is asking, okay, do you know the difference between the pathophysiology of a tension pneumo as compared to a brain injury? Sometimes they can be kind of similar. So again, you're going to have to know the different areas that you're looking in here. Here's another item that I've got in here. I'm not going to go through it because it doesn't change anything. You're welcome to go through that and challenge yourself on it if you want the PowerPoints. Here's an example of in this particular situation. Now we've got a capnograph on here, and it's wanting you to select the two answers that are going to be the most correct. In this particular situation, causing for a patient to have retained CO2, hypercarbia, and reduced minute volume. You notice in there, it does not say retained CO2, but it calls for hypercarbia or hypocarbia. So again, that comes into play for the different midterm. More questions along that line that you are welcome to utilize. I put those in there for that purpose. Now, as we're getting, here's one for an EKG for a rhythm strip. Here's one for another drag and drop. Now, so as we're kind of closing this out, and again, I want to leave some time for questions if you have them. Taking your registry exam is high stakes. I don't care whether you're an EMT, I don't care if you're a paramedic. You've put a lot of time and money and effort into this, and you really want to pass it the first time, and I don't blame you. So the second thing is try to reduce your anxiety on the preparation part for your registry exam. What I tell students is that the day before, 24 hours before your exam, do not do any study, do not do any review, do not do anything as far as test prep 24 hours before. Go out and do something that you enjoy doing. Preferably, I tell my students don't work the day before. Okay. Sometimes they have to work, but I leave that up to them. But if you enjoy to go swim, if you enjoy to ride a bike, if you enjoy just going for a walk or going to a movie, go do something that is fun for you. Second thing I tell you is that 24 hours, I'm sorry, 12 hours before the exam, 12 hours before the exam, no alcohol. Okay. No alcohol. Alcohol, again, it will help you with your anxiety, kind of, but it will also numb those cells that you're going to need. What about the day of the exam? Well, when you get up, make sure that you have a good breakfast that is high protein and low simple carbohydrates. Because what you're going to need is because you're going to be in there for probably about 2 hours, and you're going to want that protein to be able to fuel your brain with glucose. The other thing I tell you is before you go into taking your test, walk rapidly around the parking lot for about 5 or 10 minutes. Get your heart rate up, get blood going to your brain, because again, not only is by increasing your heart rate, are you going to get glucose going to your brain, you're also going to get oxygen coming in, and you're going to clear out some of the cobwebs left by that CO2. When you're taking the exam, make sure you know where you're at in the scenario. If you've already moved beyond the scene safety and the initial assessment part, don't select questions that you would have already done based on where you're being told where you're in the scenario. Don't play the what if game. Okay. Don't think like a clinician, think going around and going through there. And the big thing here is don't wait until the last minute. Start preparing now. You know how you can best study. You know how what is best for you as far as the way that you're able to retain the information. When you're using apps, okay, uh, make sure that you're using a reputable app. A lot of the apps that are out there to get you ready are trash. They're garbage. They do not understand how the registry is tested, and they'll ask you lots of memorization type questions. Remember, you're not going to see those types of questions on your exam. And then study on a daily basis. Get ready. As soon as you can take your exam, after you've been approved, jump in there and take it. Do not wait until 30 to 60 days after the exam because it's going to be more difficult. The research shows the highest pass rates are for those patients, for those students who take the exam within the first 2 weeks after they've been approved. Now, again, in this, there are several different links within the registry's website. And again, I'll send this to your instructor, or you can download it again from the QR code that's coming up. There's more information. Registry has some practice questions that are in there for each one of the types that they're different from the ones that I've shared with you. They have it for the paramedic, for the advanced EMT, as well as for the EMT itself. My email is over there on the left side. If there is anything I can do to help you pass, all you do is reach out. I've got some free prep items that I use. I tutor students from all over the country who have struggled to pass the registry, so I built stuff for them that I give them to them free. I'm more than likely happy to help you with that as well. If you scan that QR code, that should take you to this presentation. So I'm going to leave that up there for just a minute. Ben, does anybody have any questions?
I'm sorry, I've got to wake them up first.
That's okay. They're like my students.
Did my class got any questions?
Any questions?
What are reputable apps that you recommend?
Do you have any recommendations for reputable apps?
So, first of all, the only app that I recommend for my students comes from Limmer Education. Dan Limmer has been in the business for decades, and he is the guru on writing test questions. And the reason I like Dan's test apps is that he not only tells you why the right answer is right, he also tells you why the wrong answer is wrong. Now, full disclosure, I don't want anybody to think I'm trying to sneak something by you. I've done some contract work for Dan. I've written some questions for him. I've recorded webinars for him. And I've had other app companies ask me to do the same thing, but I've refused to do so because my reputation to me is really, really important. And so Dan is the only company I will work for as far as a contract basis. And the nice thing about this is that he has study apps for every level, from EMR to EMT to paramedic. The EMT app is called EMT Pass. The paramedic is called Paramedic Pass. For advanced EMT, he's got Advanced EMT Pass. He's got stuff in there for ACLS. He's got stuff in there for trauma. He's got stuff for medical terminology. So, and they're not terribly expensive. And once you buy them, they're yours. You don't have to renew them. So, Limmer Education would be the place that I would tell you to go. Good question.
And if you are interested in those, nice thing is, because I know Dan as well, know their organization. If that is something you are interested in, for the basics, I've given that information to your instructor. For my folks, I don't have it in here, but I have a discount code for you.
Yeah.
If it is something that you want to pursue, I do have that on a discount code. And once again, I get nothing from it. I'm just trying to give you, because like Dr. Young said, I know there's a lot of fly-by-night stuff out there.
Yeah.
I bit the bullet and went down one of those rabbit holes, purchased their stuff, and asked him. I said, "How do you make this guarantee that you're making?" And I get crickets from him. I've asked several companies that hey, let me look at your stuff so I can, because I want to vet it. I want to make sure it's good and giving you good information. But most of these companies, I hear crickets from, because they don't want an instructor to come back and find the flaws in their program, or they're just trying to sell you something.
And this is one of the things I like about Limmer is that if you send Dan an email, he will always respond to your email, and most of the time you'll get a response from him within about 24 hours.
Any other questions?
Yeah. Any other questions?
Thoughts, concerns?
All right.
Twice. Y'all just ready to go to lunch?
I don't blame them. I don't blame them. So, all right, Ben, what I'll do is this is